Namaste and welcome to the next lecture of Clinical Ayurved. Myself Dr. Mayuresh Agte. Let me clear first that we meet on every Friday evening generally, but this week there is some change in the schedule as I am going to be very busy in next few days in some work. So I have decided to upload this week lecture little early, and if possible I will upload next week lecture also in this week. Let us see how it happens. So we were discussing pravahika regarding Annavadha Vyadi, and I have asked you one question that in Samprapti of pravahika the Vatadosh which is Prakupit drags down the Kledak curve from the Amashay to the Pakvashay. So the question was, during this journey, why this Kledak curve doesn't stick to the Grahani as it sticks to the Pakvashay or the large intestines. So what is the reason behind that, and I will share my logic behind this phenomenon. Now what has happened, there is Prakupit Vatadosh. This is the classic Pravaga Samprapti is a classic example, as I told you in the last lecture, that Pittam Pangu Kapam Pangu Pangavo Mala Dhatavaha Vayuna Yatra Niyante. So Vatadosh is so powerful that it drags this Kapha dosh from Amashaya towards the Pakvashaya, where it gets stick down to the intestinal walls of the large intestines. This Sthana Kapha, which is now adherent to the intestinal wall, the nature of the body or reaction of the body towards this is throw it outside the body, because it is like a foreign material or something which is not normal in the Pakvashay has been adherent to it. And in this effort of the body, there is again Vata Prakop, again Rukshata, increased Rukshata, and this Ruksha again makes this Sthana Kapha more adherent to the intestinal wall. So I have explained you in last lecture. My question was, there is Laghuantara or Grahani in between Amashay and Pakvashay. So why this Kapha dosh doesn't get Sthana or adherent to the middle part of the Annavaha Srotas? So let us go just in the physiology. The Kapha is in Amashay, and which is known as Kledak Kapha. Function of the Kledak Kapha is Kledana. Whatever Anna Sanghat has been taken by the person, it makes it emulsification. So when you are saying Kledak Kapha, which guna will be dominant in the Kledak Kapha? Always remember, Vata Prakop, Kapha Prakop, Pitta Prakop are all generalized terms. Unless and until you don't know which guna is Prakupit, you will not able to find the exact nature of Samprapti. In the same way, when you are learning Sharir Kriya, you should know this is a function of Kapha, it's generalized term. But in that function, which guna is required or which is dominant or which is active, you should know that particular guna. Then only in Nidan, the Vikruti of that particular guna and its effect can be understood. So when you are saying the Kledak Kapha is in Amashaya and it is a Kledana Karma which makes the Anna Sangha emulsify, which guna is more dominant, will be dominant among the guna of the Kapha? Of course, Kledane Snigdaha. Kledane Snigdaha. Now, Kapha dosh is of two Mahabhuta composition, Prithvi and Jala. This Snigdha guna comes under the Jala Mahabhut. And what is the peculiarity of Jala Mahabhut? Again, it's of Drava Dharmi, Drava Gunamak, and what is the definition of Drava Gun in Padartha Vignan? You must remember it that the guna which travels from the highermost side to the lowermost side. Hence, the water which has been in the rainy water which gets poured down on the top of the hill travels along the hillside until the lowest part of the bottom of that area, bottom area where there is no further slope, and hence dams are always built in such area which is called as catchment area. It is the lowest part of that region where the water gets accumulated, or you can say jala. Similarly, if the snigdha gun is of jala mahabhut pradhan, it must have natural tendency to flow from upward to downwards. Okay, so Prakupitvar drags down this kapha which is of Jala Mahabhut Pradhan in nature. This property of Jala Mahabhut of flowing from the topmost part to the lowest most bottom of part indirectly helps to the action of Vata dosh to drag from the this kapha dosh from upward to the lower side of the pakwa or lower side up to the pakvasha. Now during this flow, as I said, why doesn't it get adherent to the large intestine? Small intestine is because of Dravagun. Because Dravagun has find direction towards lower side. So by nature, this Jala Mahabhut Pradhan Kritak travels naturally after Amashay to Grahani and then small intestines, and then the last portion is Pakvashay where it gets the ultimately reaches to the Pakvashay. Now question remains, again there is Gati towards outside by Dravagun. It should flow from the Pakvashay to the rectum and then should get extruded from the body. Here little change in the Samprati happens, that there is Pakvashay is of Vata Pradhan, Pramukhya Avayava of Vata Dosh, Ashay. Vata is increased, like Chalagun, it drags Kapha Dosh. Similarly, Vata Prakop in that area, the Rokshata is also increased, and because of this Ruksha Guna, increased Vata Dosh which is dominant and Ruksha Guna is increased, it makes that Snigdha Kapha dry or styan, and because of this styanata, it gets adherent to the Pakvashay walls, and though it is of Dravaguna, this styanata makes it adherent, and Kleda curve which is Jala Mahapradan can't get outside the body by its natural tendency of Dravata. So up to Pakvashay it goes lower direction, so it flows easily, and in Pakvashay the increased Rukshata of the Vata dosh makes this Jala Mahabhut Pradhan Klida curve stand and gets stick to the intestinal walls. This is the first reason why it doesn't get stick to the Grahani Avayav or Lagvandra. And second is maybe during this travel from Amashay to Pakvashay, there must be some interaction happening of this leather curve with the Lagvantra or Grahani, and the symptoms of that reaction may appear as Pururupas in the Pravahika, but as we know, very few patients come to us in Pururupa, hence even patient can't get it marked during that traveling of the Kapha dosh, and we get the patient with the symptoms of Pravahika directly. So this is my logic that Dravagun assists the flow from Amashay to Pakvashay by its natural tendency, and in Pakvashay, Rukshaguna dominates this Dravata, makes it stand, and the cuff gets adherent. Now this process is not so easy and doesn't happen in 1 or 2 days. It takes many months. Why? Because there are two sphincters, one in between Amashay and duodenum, and other is small intestine and large intestines. This is my opinion. These two sphincters prevent this flow of Dravagund, which has natural tendency to flow from upwards to downwards. Otherwise, there is tendency of Dravagund to flow from up to downwards. The curve can easily pass through the Amashay, easily pass through the Lagvantra or Ingrahani and go to the Akvashay easily without any problem. But these two sphincters prevent this flow of the Jalamahanupadan curve, and this when they pass to the Grahani or pass to the ileocecal junction, then it's the sticking of the in the Pakvashay process starts, and it is not so easy. It is a time taking process. So this is the my logic of Sampratya Pravayika. I will appreciate your opinions. We will meet in next lecture about Pravayika shortly. Thank you very much.